IDT is about a 30-year-old company based here in Melbourne and in Adelaide. Part of the business is involved in contract development of drug manufacture and scale-up, and we focus on cytotoxic and high containment drugs, so things like cancer drugs, antibiotics, hormones, those sorts of things that require quite a high degree of containment. So the operators work inside controlled atmospheres, inside containment suits hooked up to airlines and so forth, and we can manufacture from gram through to sort of almost tonne scale of drug for high value drugs. And the other part of the business is CMAX in Adelaide, which is Australia's biggest clinical trials unit. So we do largely phase 1 studies there, so first-in-man studies, pharmacokinetic studies, those sorts of things, but we also do participate in phase 2 and 3 studies as well for testing drugs on patient groups. I only joined the company last April, so a new management team, largely new board. So we're trying to beef up the existing base business, so do more of the contract work that the company's been known for historically, but also starting to layer in on top of that, developing our own generic drug portfolio. So we now filed our first abbreviated new drug application with the FDA last November, and just today we announced an option to acquire another ANDA for a hormonal HRT product. So we're really moving towards having our own portfolio of generic drugs. Both Boronia and CMAX, I guess you could characterise them as the picks and shovels of the drug development business. So as we've seen an increase in capital inflows into the sector over the last year or so, we've certainly seen an increase in the number of inquiries and the number of jobs that we're winning for that sort of contract work. And at the same time, obviously looking for assets that we can bring in to take ownership ourselves and increase our share of the value chain. Essentially, really, it's a value chain play. So as a contract developer and a manufacturer of API historically, which is the active pharmaceutical ingredient rather than the finished dose form, the share of the value chain for those activities is actually relatively low. Once you move up to being the owner of the registration, the value chain share becomes greatly increased, sort of tenfold. So we're really looking for an increase in revenues without a great deal of increase in activities.